What are health equity principles for healthcare access? Imagine a world where everyone can get the healthcare they need without facing obstacles. That's what health equity principles aim to create. They focus on making sure all people have a fair shot at good health. These principles recognize that some groups, like people with disabilities, face more barriers than others. To fix this, healthcare systems follow specific rules to promote fairness and justice. Resources and care should go to those who need them most, not based on race, income, or where someone lives. This means addressing past and present injustices that keep some groups from accessing quality care. Removing barriers is a big part of these principles. Think about transportation issues, inaccessible buildings, or high costs that stop people from getting help. These obstacles can be physical, like no ramps or elevators, or systemic, like insurance policies that don't cover certain treatments. Addressing these issues involves making facilities accessible for everyone and ensuring insurance plans cover needed services without excessive costs. It also means training healthcare workers to recognize and overcome biases that might affect how they treat patients from different backgrounds. Health equity calls for strategies that fit each community's needs. Different areas face different challenges, so one size doesn't fit all. For example, rural communities might need mobile clinics or telehealth options, while urban areas may focus on language services or culturally competent care. Policies should be flexible and adaptable to changing circumstances and local needs. Including people from marginalized groups in decision-making is essential. When those with disabilities or from underserved communities help shape healthcare policies, the services become more relevant and respectful. Their voices ensure that care is designed with their needs in mind. Collecting and analyzing data is another key part. Healthcare systems gather information on health outcomes, access, and barriers, broken down by factors like disability status, race, or income. This helps identify gaps and track progress over time. Without good data, it's hard to know where to focus efforts or measure success. Cultural competence is also vital. Healthcare providers should understand and respect different backgrounds and experiences. This includes being aware of cultural beliefs, language differences, and disability-related needs. Proper training helps build trust and improves communication, leading to better health results. Affordability and timeliness matter too. Care should be affordable, with costs that don't prevent people from seeking help. Wait times for appointments or emergency services should be minimized so that everyone gets timely care. Geographic accessibility is about making sure healthcare facilities are within reach. For people living in rural or remote areas, this might mean establishing clinics closer to their homes or offering transportation options. In practical terms, applying these principles means designing healthcare spaces that are physically accessible for all disabilities. It involves providing information in formats like Braille, sign language, or easy-to-read materials. Training staff to understand disability needs and respecting patient preferences are also part of this approach. Policies should support coverage for disability-related health services without discrimination. Including people with disabilities in planning and policy discussions ensures their needs are met. By following these health equity principles, healthcare systems can work toward removing disparities. The goal is to create a welcoming, inclusive environment where everyone, regardless of their background or abilities, can access the care they need to stay healthy and thrive.